as Julio said, my name is Clarence. So I'm a candidate advanced nurse practitioner working in Dublin, Ireland at the moment. So I'm currently partaking in my master's in advanced nursing practice. And what that essentially means is that when I complete it, I will be able to complete a full episode of patient care. So if we're talking about long-acting injectables specifically, it means that I will be able to assess a patient to see if they are suitable for LAIs. I will be able to investigate clinically with lab investigations, and I will also be able to prescribe and arrange follow-up for that. So we have about 500 people living with HIV in our patient cohort, and as of Monday, 15 of which are on LAIs. Okay, so quick introduction. Prof. Molina gave us a very short and concise summary of this. However, I think long-acting injectables do represent one of the most significant advances in HIV treatment that we've seen in recent years. So as you can see, we're talking about formulations that change from pill-dependent doses for treatment to now monthly or bi-monthly injections. So the benefits, as we know, are very substantial, which include adherence rates, because patients are no longer facing the daily reminder of their HIV status, and which reduces stigma. So the key point for all of us in this room for this talk is that nurses are absolutely central to making LAI implementation successful, because we're not just administering injections, but we're the bridge between clinic-based care and the community. And we're the ones building relationships, we're educating patients, and ensuring that continuity of care. So this brings me to my first major point, which is public patient involvement, or we might know it better as PPI. And what it means is actively involving patients at every stage of our LAI services. So that's in the design stage, the delivery, and the evaluation. And why this is so crucial is because my research found that when we engage patients early in the process, we build their trust. So we identify their real concerns about switching to injectables, we understand their fears, we understand what practical challenges they may have, and also how it would affect their lifestyle considerations. So the evidence is clear. Programs with robust patient involvement show significantly higher treatment acceptance rates and better long-term adherence, because when patients feel heard and involved, they become partners in their care rather than passive recipients. And I think this is a really important point to make, and we had alluded to it earlier, because I think in medicine classically we seem to have this paternalistic approach maybe, and where we think and we advise patients on what we think is best for them, when in fact it should be a shared decision-making process, because it's the patient who is living that journey. So what is the nursing role in PPI? So as nurses, how do we facilitate this involvement? So we're uniquely positioned as patient advocates, first and foremost. And some of these methods can include organizing focus groups where patients can share their experiences and concerns about LAIs. We can conduct surveys to gather systematic feedback, and we can establish peer support networks where patients who successfully transition to LAIs can mentor others. Most importantly, via all of these modalities, we create that active feedback loop. So I think it's important to point out that this is not a one-time consultation, but rather it's an ongoing dialogue that informs continuous improvements to our services. So through this nurse-led patient-public involvement, we develop truly personalized, patient-centered care that enhances both satisfaction and also treatment success. So, community organizations. Katrina spoke beautifully about the community organization, which I've already forgotten. What are they called? Acqueer. Okay, I hope I did the pronunciation justice. But okay, so community engagement. So they're very important because these networks you see here, so it's the HIV advocacy groups, social support services, local clinics. They're all representative of the vital community organizations that we need to partner with. So as nurses, we're often the ones building and maintaining these partnerships. We coordinate awareness campaigns, develop educational materials, and we support outreach efforts that extend far beyond our clinic walls. So this is particularly critical for reaching our marginalized populations who may not be able to access traditional healthcare settings. Through community partnerships, we create trusted environments where people feel safe to learn about and access long-acting injectable therapy. So we are not just treating patients, but we're in fact transforming communities. So in terms of stakeholder engagement and collaboration, as you can see in this network here in the top left corner, we're talking about patients, multidisciplinary healthcare teams, pharmacists, community leaders, and even policymakers. So again, my research consistently showed that nurses serve as the central liaison in these networks. So why? Because we coordinate communication, we align care plans, and we ensure that everyone is working toward the same goal and are on the same page. So for our pharmacy colleagues here, this collaboration is equally as essential because we work together on medication timing, storage requirements, patient education about side effects, and coordinating refill schedules. So needless to say, the nurse-pharmacist partnership is absolutely crucial for LAI's success. So thank you to Nadia and all the pharmacists in the room. Okay, so challenges. We love talking about challenges, but thankfully I also have solutions for you. So implementing community support for LAIs isn't without our challenges. We face significant barriers such as HIV-related stigma, misinformation, logistical issues, and also cultural concerns. So our nursing skills shine through to try and overcome these. So why? Because we develop targeted education sessions to address misinformation. We advocate for flexible scheduling that works with patients' lives. And we train and coordinate peer navigators who can provide culturally appropriate support. So these solutions require us to think beyond traditional clinic models. We need community-based options, ongoing cultural competence training, and most importantly, communication that's tailored to each community's specific needs and concerns. I made it on time, I can't believe that. Okay, so we've covered a lot of content in a very short period of time there. However, in summary, the role of the nurse extends far beyond the clinical administration of LAIs because we lead on patient involvement initiatives, we build and sustain community partnerships, and coordinate complex stakeholder relationships. We are community health advocates, relationship builders, and care coordinators. We ensure that our LAI services are not only clinically excellent, but also responsive to patient needs, accessible to diverse communities, and aligned with the realities of people's lives. And this holistic approach is what makes the difference between an LAI program that simply exists and one that truly transforms HIV care in our community. So, few take-home messages here. First, successful LAI implementation absolutely depends on robust community support structures. Second, we know that nurses are uniquely positioned to champion patient involvement and foster collaborative relationships across all sectors. And thirdly, ongoing investment in nursing roles within community networks isn't optional. It's absolutely essential for the sustainable LAI access and long-term program success. So thank you again for your attention. And I think the biggest take-home message I want to bestow onto you is that I think each and every single one of you absolutely do engage with your patient cohort. And these are 3 takeaway questions that you can answer that will make you realize that you do so and advocate. And if you don't, these are 3 questions that you can answer and can hopefully be future exercises for yourselves. So thank you.